Today, the history of the asbestos crisis in Australia. Hello again, it's Martin North from Digital Finance Analytics. Welcome to this post covering finance and property news with a distinctively Australian flavour. We continue our series today on asbestos-related subjects using information from Asbestos Awareness Australia. And today we look at the history of the asbestos crisis, which frankly is pretty shameful. The history of asbestos actually reveals that many corporations cynically disregarded the health and ultimately the lives of others by making commercial decisions to mine and manufacture asbestos decades after its dangers were publicly recognised. The asbestos crisis in Australia is actually far from over, and the ongoing risks and harms are poorly documented and comprehended. Here is a summary of the asbestos timeline, because that's the best way to understand the current settings and to set the scene for the evaluation of measures and policy options to minimise future fatalities from asbestos-related diseases. So in the 1880s to 1920s, asbestos mining began globally, with mines opened in Canada, South America, South Africa, America, Italy and Russia. James Hardie Industries Limited, we'll call them James Hardie from now on, began its business as an importer of asbestos and asbestos-containing products in 1903 and initiated manufacturing of these products in 1916. In 1916, Wonderlook Limited revived its asbestos mine in Andersons Creek in Tasmania. Prior to 1969, the Wonderlook business was run by the Wonderlook brothers. The dangers of asbestos fibres were being highlighted and discussed by medical experts and Commonwealth government departments during this period. By the early 1930s, there was significant medical and industry knowledge about the links between asbestos and asbestosis, a disease with significant long-term morbidity rates and associated mortality. These dangers were highlighted in a report published by Meriwether and Price in the United Kingdom in 1930 and in a subsequent investigative report in Australia a year later. In April 1933, James Manville, a large producer of asbestos-related products in the United States, privately settled 11 cases involving asbestosis. And in 1939, the first court action against James Hardie for death caused by asbestos dust was initiated. In the early 1940s, CSR Limited, I'll call them CSR from now on, began asbestos mining in Whittlemoon in Western Australia with financial support and encouragement from the West Australian state government. During the 1940s, Malcolm King, a senior operations executive of CSR, travelled overseas to talk with other asbestos companies, including James Manville in Canada and Cape Asbestos in South Africa. King is cited as admitting that from these discussions, quote, "we were always aware of some danger from inhalation of asbestos fibre." From 1940 to 1953, Wonderlook Limited operated an asbestos mine near Bowyegill, New South Wales. And in 1953, control and management of this mine passed to James Hardie. And from 1976, Woods Creek Mines Limited operated it for a further 3 years. During the 1950s and 60s, the number of lung cancer and mesothelioma diagnoses linked to asbestos exposure continued to mount. In 1955, Dole published a seminal paper linking asbestos with lung disease. And in 1960, Wagner and others published an equally significant paper on asbestos exposure and mesothelioma. And from the 1960s, concerns regarding non-occupational exposures to asbestos were increasingly highlighted by medical experts. For example, Wagner and others highlighted mesothelioma cases caused by environmental exposure in South Africa. Newhouse and Thompson identified mesothelioma cases linked to household exposure in London, and Lieben and Pistalka discussed mesothelioma cases linked to non-occupational exposure in the United States. Meanwhile, in Australia, Peter Russell, the safety officer of James Hardie, told the company management in April 1961 that asbestos was, quote, one of the most dangerous of industrial poisons. And he further advised them in 1964 that the company had a moral obligation to asbestos product users to provide warnings of the dangers of using their products. In 1964, a landmark article by Selikoff et al. Highlighted cases of asbestos-related deaths, mesothelioma, asbestosis, lung cancer, and other forms of cancer in insulation workers with relatively light and intermittent exposure to asbestos. The authors concluded that the possibility of environmental exposure to asbestos had long been known and suggested many other types of tradespersons would likely suffer similar outcomes. In 1964, a study by Selikoff showed that asbestos workers who smoked had 90 times the risk of developing an asbestos-related cancer than non-smokers with no exposure to asbestos. Publication of conference proceedings in 1965 stated that the only safe level of asbestos exposure is 0, and that as far as a safe level of asbestos dust is concerned, there is no safe level. The safe level is nil, and anything above the safe level is certain risk. The personnel manager of James Hardie distributed extracts from these papers in March 1966. A letter dated February 1965 from Professor Gandevia of the Prince Henry Hospital to the personnel manager of James Hardie indicated that recent published work leaves no doubt of this association between asbestos and mesothelioma, and the exposure can be quite small. In February 1966, the chairman of James Hardie, Mr. Reed, received a newspaper article published in October 1965 warning about linkages between mesothelioma and exposure to families living with asbestos workers. And in July 1966, the chief medical officer of James Hardie warned the factory managers that cancer was a health risk, that there was no safe level of exposure to asbestos, and that sales may be affected. In 1966, the personnel manager of James Hardie sent an email responding to an article in the Financial Times regarding the dangers of mesothelioma, stating that the article is not new. It is merely one of many reports on world studies that have been conducted since 1935, where the association between exposure to dust and carcinoma of the lung, mesothelioma of the pleura, tumour of the bladder and uterus, and other fatal complaints was first recognised. And in 1966, CSR closed its mine in Wittenoom for business reasons. An article published in the British Medical Journal in 1967 observed that there is a vast number of do-it-yourself enthusiasts who may be exposed intermittently to highly concentrated asbestos dust. The author notes that in some cases extremely short exposures have been reported. And in 1967, an article in the Archives of Environmental Health noted that the occupational exposure of installation workers or textile workers was certainly many thousand times higher than those of neighbourhood cases or family contacts. In fact, a paper presented at a conference in Sydney in 1968 highlighted the case of an electrician with mesothelioma whose exposure to asbestos was limited to half an hour twice a month over 5 years. A report of these proceedings was circulated within James Hardie. And an article published in the Medical Journal of Australia in 1968 warned of the development of mesothelioma after minor exposure to asbestos. In fact, in 1968, the case of a 14-year-old boy with mesothelioma was highlighted in an article in the New Yorker. This boy had worked with his father sawing asbestos sheets. In 1969, CSR purchased the asbestos cement sheeting business of Wonderlink Limited and operated this company until it was sold to James Hardie in 1977. In the 1970s, authors of a study of mesothelioma sufferers involving neighbourhood and domestic exposure in Germany noted the remarkable fact that this exposure may be very short. In the 1970s, media coverage of the asbestos crisis heightened in Australia, and unions commenced industrial action to ban the use of asbestos. In 1976-1977, the World Health Organization and the International Agency for Research on Cancer confirmed that there was no safe level of exposure to asbestos and that exposure risks extend to neighbourhoods. Despite this advice, sales of asbestos-containing materials in Australia continue to climb. In 1977, James Hardie opened a new state-of-the-art asbestos cement pipe factory in Moss Vale in New South Wales. And in 1978, the chairman of James Hardie, John Reed, publicly boasted that every time you walk into an office building, a home, a factory, every time you put your foot on a brake, ride in a train, see a bulldozer at work, every time you see or do any of these things, the chances are that a product from the James Hardie group of companies has a part in it. Less than a year later, the company that then was called James Hardie Asbestos Limited, with a headquarters in Sydney, known as Asbestos House, changed its name to James Hardie Industries Limited. The prior names of the company and headquarters reflected the group's primary focus on asbestos products. And James Hardie continued to mass-produce asbestos-containing building products until the mid-1980s and manufactured asbestos cement pipes until 1987. A Canadian-owned asbestos mine at Woods Creek Mine near Tamworth continued with New South Wales state government support in the form of royalty holidays and concessional loans until 1983. The main domestic customer of this mine was James Hardie Industries Limited. The first successful common law action made on behalf of Australian asbestos-related disease victims arose during the 1980s after many decades of private settlements. Chrysolite asbestos was banned in building products across Australia in 1987. The first court victory for the Wittenoom victims was in the late 1980s. The Victorian Appeal Court ruled that CSR had acted with continuing, conscious and contumelious disregard for its workers' safety. Ian Burgess, the Chief Executive Officer of CSR, conceded that the company has been found negligent in regard to the dust, and I think probably properly negligent. I mean, you can't hide behind that, but the mines department did not close the mine down, and they had the power to do so. In the 1990s, studies were published on the lethal environmental exposure of residents in Wittenoom. Now, in the 21st century, a total ban on the manufacture, use and stock of asbestos took effect at the end of 2003. A study published in 2008 confirmed the excess cancer risks of women and children who worked or lived in Wittenoom. In 2010, the Australian federal government commissioned a review to make recommendations for the development of a national strategic plan to improve asbestos management in Australia. And in 2011, the first parliamentary group meeting on asbestos-related disease took place. The Workplace Health and Safety Act 2011 was introduced nationally as model legislation for the management of asbestos in workplaces. This model legislation was enacted by the states and territories as workplace health and safety regulation to govern the handling of asbestos, the removal of asbestos, training of persons working with asbestos, and the licensing requirements of abatement professionals. At the end of 2011, Safe Work Australia issued a code of practice that provides guidance on how to respond to asbestos risks and contains information on identifying asbestos materials, how to report asbestos properly, and how to manage the risk of exposure in a work setting. In 2012, the Asbestos Management Review considered the evidence and made a series of recommendations, including, first, the development of a national strategic plan and the establishment of an independent national agency to guide the implementation of this plan. Second, the introduction of mandatory asbestos assessments of residential homes built prior to 1987 with a labelling system to alert potential buyers, tenants and renovators of identified threats. Third, a plan to provide for staged removal of all asbestos-containing materials from government and commercial buildings by 2030. The then federal government indicated that it supported these review recommendations, but so far only the first step has been implemented. In 2012, the Office of Asbestos Safety was established. On 1 July 2013, the Office of Asbestos Safety was replaced by the Asbestos Safety and Eradication Agency. The Asbestos Safety and Eradication Agency is empowered under the Asbestos Safety and Eradication Agency Act 2013 to coordinate a framework for the Commonwealth, states and territories to work together to prevent harmful exposure to asbestos and to eliminate asbestos-related disease. The Asbestos Safety and Eradication Agency confirms that it was set up to provide a national focus on asbestos issues, which goes beyond workplace safety to encompass environmental and public health concerns. Despite these worthy ambitions, our research suggests that public acknowledgement of asbestos issues in Australia beyond workplaces remains minimal and equivocal. Our household survey results suggest the broader community remains largely unaware of the public health risks and impacts of legacy asbestos in homes, and further, our analysis of available public health guidance suggests current warnings to householders about the health risks of asbestos exposure are qualified, incomplete, and poorly disseminated. The only legal actions that we are aware of that have been brought against the company directors and executives of James Hardie, CSR or Wonderlic Limited were civil proceedings initiated by the Australian Securities and Investment Commission against the directors and legal counsel of James Hardie for breaches of continuous disclosure law and the statutory duty of due care and diligence. These breaches centred on misleading disclosures to the market about the sufficiency of funding available to asbestos-related disease claimants and did not extend to broader operational or safety matters. Some aspects of these cases were appealed to the High Court, with its final judgment released in 2012. Studies and meta-analyses of prior medical studies published in 2017 and 18 found positive and strong associations between non-occupational exposure, including neighbourhood, domestic and household exposure, and the risk of mesothelioma. Marsh and others conclude that mesothelioma risks from non-occupational asbestos exposure are consistent with the fibre-type potency response observed in occupational settings. And other medical researchers highlight cases of mesothelioma arising from much lower dosages in non-occupational settings than observed from occupational sources. A study released in 2019 predicts the mortality rates of women who worked or lived in Wittenoom. And Reid concludes that exposure to asbestos from the general environment at levels lower than incurred occupationally has had a catastrophic effect. In 2019, the youngest person diagnosed with mesothelioma in Australia was 19. At the end of 2020, the Supreme Court of South Australia found that at least by 1980, James Hardie ought to have known that there was a material risk of contracting mesothelioma from even occasional exposure to asbestos dust, which would arise from tradespeople and householders remodelling, repairing, or removing asbestos cement products in residential buildings. Importantly, awareness of the risks, suffering and deaths resulting from asbestos exposure in Australia was not limited to those working in the industry. Multiple sources note that the asbestos materials industry was permitted to continue to operate because it was able to influence or have the support of many government officials, policymakers, public health administrators, medical and legal professionals and researchers. Quotes from the sources below are those that, in our view, are most consistent with the documented history of asbestos and published scientific developments. This selection is not intended in whole or in part to be complete or balanced, whatever this means in the context of the asbestos crisis. The clinic suggests that the industry was allowed to decide what constituted the public good and what level of risk to employees and consumers was acceptable. Industry, of course, viewed the acceptability of risk as being a trade-off between its own special economic interests, which it equated with the common good, and the potential loss of profits which would result from morally responsible behaviour. Brophy argues that all you really need to know about the root causes, the cover-ups and the human impact of occupancy cancer, you can learn from the example of asbestos. It also tells you everything you need to know about the reality of our economic system, what it values and what it fails to protect. It teaches about the collusion between government and industry. It addresses the issue of so-called junk science and how the powers that be control information and public health policy. It reveals the hidden injuries of class, and it drives home the old axiom of working class history that everything you get in the society you must fight for. Haid concludes that, with only a few notable exceptions, the attitude of health authorities in Australia was at best apathetic, at worst culpable. And Peacock suggests that, backed by a global network of industry, PR and research, Hardy dominated key institutions in the public health bureaucracy, both state and federal, and influenced the crucial tasks of setting safe standards and monitoring asbestos dust and disease. And Peacock claims that James Hardy sought to control Australian research on asbestos and to discredit professionals who sounded the alarm. And McCulloch and Tweedale argue that the industry, in alliance with governments and the medical professional, delayed the recognition of the environmental hazards of asbestos worldwide from the 1960s. They suggest this delayed recognition allowed the growth in the manufacture and sale of building products containing asbestos to mushroom during the 1970s and was a major contributor to the ensuing health disaster. McCulloch and Tweedale claim that not only was the medical profession's reaction to the asbestos hazard often feeble, but scientists have also been among the industry's most strident defenders. There are two reasons why this is so. Corporate suppression and intimidation meant that criticism of the industry came at a price, and the convergence of the economic, political and social interests of the scientific establishment and commerce. And Braun et al. Extend the suggested network of entities that work together to obscure the hazards of asbestos to biomedical researchers, multinational companies, academic institutions and nation-states. And Braun et al. Suggest the asbestos industry deployed a range of international strategies to control the population and dissemination of knowledge about asbestos. Such strategies include direct suppression of data from industry-sponsored research, selective publication of research findings, and the systematic use of scientific knowledge to create uncertainty. These authors note the willing participation of scientists in these endeavours. Soberg et al. Suggest that the asbestos ban in 2003 in Australia was a significant victory for the trade union movement, but unfortunately represented a story of the lack of political will by governments at federal and state level to act in the health interests of their community. And Smythe contends that vested interests in the asbestos industry, the keepers of the secret, acted to thwart public disclosure in manifold ways. The industry managed its intelligence and its image very carefully, engaged the service of public relations firms, and established medico-scientific bodies to do its bidding. He suggests that contacts within the industry were reluctant to blow the whistle. The unions were compromised or complicit. Publishers and broadcasters did not want to rock the boat, and asbestos executives curried favour with media management. These published views suggest blame or accountability for the continuing large-scale fatalities from asbestos-related disease in Australia can be widely attributed. And interestingly, the outlined views are generally historically framed and perhaps assume that the identified patterns and strategies have been resolved, yet our researchers observe the same patterns of suppression of information, careful management and restriction of public communications, limited media coverage, and passivity around asbestos threats in 2021. To be crystal clear, the asbestos crisis is far from over, and the deaths from asbestos-related disease will almost certainly continue under the current legal and other settings. Critics will undoubtedly call such discussion alarmist, but in this case, alarm is in fact warranted. The present risks of exposure to legacy asbestos in Australia are as real and substantive as the prior risks of exposure to asbestos-containing materials when those products were manufactured and sold legally. Australian households remain at risk of dying from occasional or brief durations of exposure to our legacy asbestos in their homes, and our survey results suggest that most are not properly informed about these risks. Since 2008, 52% of the mesothelioma claims made through the Asbestos Injuries Compensation Fund, which was established by James Hardie in 2006, have been categorised by KPMG, the auditor of this fund, as home renovation related. These percentages rose to 60% and 55% in 2018 and 2019 respectively, and the number of these types of claims reached a record number in 2019. Mesothelioma is a notifiable disease in Australia, with more than 830 recorded diagnoses in 2020. There is no cure for this disease, and it has a stark prognosis. Professor Ken Takahashi, director of the Asbestos Diseases and Research Institute, confirms that we don't even have a drug to treat mesothelioma once a diagnosis is confirmed, much less one that will prevent its development once someone has been exposed to asbestos dust. Vercon Delet, a medical professor, describes mesothelioma as perhaps the most terrible cancer known, in which the decline is the most spectacular, the most cruel. Yet despite the continuing horrors of a mesothelioma or lung cancer diagnosis, there have been no nationally coordinated public health campaigns in Australia on asbestos threats. The amount of federal, state and other sources of funding provided for research of these diseases has been and continues to be disproportionately low for the burden suffered, and there is incomplete state-based regulation governing the handling of asbestos in residential properties beyond workplace settings, and committed, systematic and timely asbestos eradication programs appear to have stalled across Australia. So, in summary, the published evidence, concessions, warnings and statements, if true and accurate, provide important context when considering the accountability of those involved with the continued manufacture and marketing of asbestos-containing products in Australia during the 20th century. Views on when the leadership of James Hardie and CSR and the federal and state governments knew or ought to have known about the dangers and health impacts of asbestos on humans differ. Some industry participants and state governments continue to claim that their knowledge of deaths from asbestos-related diseases was limited until the latter decades of the 20th century. We don't find those claims plausible. In our opinion, evidence to hand today suggests that the directors and senior executives of James Hardie and CSR, the then governments and the relevant public health sectors in Australia knew or ought to have known about the burden of asbestosis in the 1930s, the links between asbestos exposure and lung cancer in the 1950s, the fatal nature of mesothelioma in the 1960s, including the possibility of contracting this disease from non-occupational sources and from low-dose and occasional periods of exposure. We're not alone in these views. For example, in the Werfel case, Chief Justice Kourakis and Justices Nicholson and Livesey found that at least by 1980, James Hardie ought to have known that there was a material risk of contracting mesothelioma from even occasional exposure to asbestos dust that would arise from tradespeople and householders remodelling, repairing or removing asbestos cement products in residential buildings. The Justices state at 153 that we do not find the expert evidence on which James Hardie relies persuasive, and indeed, in some respects, it supports a finding of foreseeability well before Mr. Werfel's exposure to asbestos. And they note at 157 that there is evidence on which foresight of that risk may well be attributed to James Hardie at an earlier time, and in particular the time of an Australian conference in 1968. The judicial analysis in Werfel may be generous to James Hardie because it assumes that the board was not aware of medical developments outside of Australia and that their knowledge was limited to academic sources, but published material suggests that sources of knowledge on the deadliness of asbestos-related disease are not just confined to formal medical publications, as we've discussed above. Industry executives exchanged information globally regarding ongoing medical developments and lawsuits. In addition, the industry conducted its own internal research. It had ongoing access to the health records of employees. It was aware of the dust level concerns, and it knew about the deaths of employees, families, and others. Some of this evidence was kept secret for many decades and has only come to light publicly through legal proceedings. Levels of naturally occurring asbestos in Australia that present potential risks to the public are minimal because such asbestos is located well underground and cannot release harmful fibres unless exposed or disturbed. In contrast, the scale of harmful or potentially harmful asbestos products inbuilt within public, commercial and residential properties is thought by most experts to be extensive. These products were originally manufactured and distributed by James Hardie, CSR, and others to every sector of the economy, and it is these legacy products that pose the greatest risks to Australians today. As such, we believe that James Hardie and CSR are primarily responsible for the continuing mass deaths from mesothelioma in Australia and for a portion of the lung cancer fatalities where exposure to asbestos is a material contributing factor. Subordinate responsibility perhaps lies with the many participants who passively sat by and who are still today failing to take appropriate actions to prevent ongoing harmful exposure to asbestos, a lethal carcinogen. The substantive questions now are, first, when will the industry, federal and state leaders, the public health sector, scholars and the media finally acknowledge the facts and evidence of the asbestos crisis publicly and unequivocally? Second, when will the industry, federal and state leaders and the public health sector initiate the necessary preventative actions to minimise loss of life from asbestos-related diseases, especially in Australian homes? The longer these steps take, the greater the accountability of these cohorts for the avoidable lives lost in coming decades and possibly centuries. Now, with regard to Asbestos Awareness Australia, it's a registered non-for-profit company limited by guarantee, and it's a registered charity and has endorsement from the Australian Tax Office as a gift deductible recipient. The company was set up to enhance public awareness and knowledge of the dangers of asbestos threats, to promote measures and policies that prevent or minimise the harms from asbestos-related disease. And to achieve these objectives, the company provides public access to widely sourced information on asbestos risks and impacts, including the associated medical, legal and political debates. I'm Martin North from Digital Finance Analytics. Many thanks for watching, and I'll see you again next time.